I just want to point out.
I know.
You know,
I am 4 minutes late.
they hold up little notes in the background. 1 minute to go, halfway. There you go. I
We
ignore
will
them.
add your 4 minutes. Don't worry.
I want that 4 minutes on the credit there. And I didn't know when they said sponsor lunch that it meant I had to go cook the lunch. So that was I hope I noticed I'm not a lasagna person, so I am sorry. I'll be talking about some items related to the dental workforce, and though it focuses heavily on dentist graduation and dentist workforce, everything said applies to hygienists, expanded functions, and dental assistants. This problem is top to bottom. I have no conflicts of interest other than the fact that I'm a dental dean. So go take fluoride out of the water and stop using fluoride. And we're going to have lots of work in dental deanships to go ahead and make dentists and allied health. It's a brilliant idea coming from Health and Human Services. I'm not going to tell you any of my personal feelings about any of this. So is there a dentist shortage? I need you to recognize Pennsylvania. It's that little Commonwealth, actually a pretty big square footage, and we're not rated as a region that's short of dentists. Well, that's actually the truth. We're actually in the top tier of dentists. Neither is Alaska, except for these 3 counties and Fairbanks. Everything in Alaska has no dentists. It's essentially a dentist desert. So is West Philadelphia, by the way. So I don't want you to think, and we have to be careful with these numbers and how they get bandied about and what to do. As of July, everything of this year, and there was an article that was written in the Pennsylvania Dental Journal on lots of this same subject, so feel free to pull it out. The references are in there where they come from. That's what Pennsylvania looks like when we get down to the county. And the thing that's deceiving there is the size of some of those circles. It's 50, 100 miles in distance. There are several hundred miles of abject shortage of individuals, and we're not going to talk about a specialist who can treat a person with disabilities, who most of you have heard me rant on that subject already. That, I can tell you, we have patients drive to our school 3 and 4 hours from the center of our Commonwealth. And there's something wrong with that. So we're not talking about specific shortages of an individual type of dentist. That's even worse. But the solution, so there's a number up top there. This comes out of the, it comes out of the PA Department of Health most recent survey. We're short right now 337 dentists in these shortage areas within the Commonwealth. But the worst item is that, as you see, of the dentists who responded, and only 35% of the dentists responded, 35% of the responding dentists are over the age of 60. It means that there's a shelf out there of people that, whether or not they want to retire, at some point in the next decade or 2 decades are going to retire. That's a massive shortage of dentists. We need to go ahead and recognize that there are many rural and underserved areas throughout our cities, throughout our Commonwealth, that are short dentists. And as we are short dentists, we see health disparities, all health disparities rise. There isn't a question that they're short of family practitioners to do general health, people to take care of diabetes, people to take care of general health. It's a general shortage. Now, I can tell you, since the 2 public stipended schools got their shout outs already, Penn Dental Medicine has made a commitment to serving our community throughout Philadelphia and West Philadelphia in a giant sake. Our students spend 20% of their education time in community-based clinics for underserved regions, whether we're talking about federally qualified health centers, centers for aging, schools throughout West Philadelphia particularly, and immigrant health centers. In 2018, I became dean at Penn Dental Medicine. We had 2 students on the National Health Scholarship Fund, which designates that they will work year for year on the fund in underserved communities. Last year at graduation, and I don't have the current statistic, we had 72 students in the class, in the school, who were participating in that program. That's a massive increase, and it was self-selected. So putting the education in the community, doing the Tamaqua, doing the West Pennsylvania programs like Marnie was talking about, they will make a difference in who you attract and who participates in program. And hopefully it will make a difference in where the people settle. But there are some nuances to that that I need to go over with you in all respects. So number of dental schools remained quite constant right until about 1990. And there was a precipitous fall in the number of dental schools. We went from 60, we lost 6 dental schools, and we stayed down for over a decade in low numbers in dental schools. Today, there are 75 schools opening. I just came from the dean's meeting on early Monday morning. There will be a total of 80 dental schools in the United States by the end of this year that are enrolling at least their first year class. The question is, do we have a shortage of dental schools? And the answer is actually no. There are things that we do know. There's a shortage of faculty. Bless all these people that think they're going to get local individuals to hire and staff and make these things run. I hope they succeed. But I can tell you, I have 7 full-time faculty positions open in Philadelphia right now at my school. Where are we going to get, and I'm not denigrating any dentist, but is every dentist the best educator for the person that's going to treat you or your child? Or is there a difference in educators and who they are, where they are, and how they were trained, and what support staffs are available to help them grow as this goes on? This is the problem that is going to face America over the next decade. The shortage of dentists in the community is a giant sucking sound out of the institutions that made them. And the implications of that are that the institutions that made them are going to struggle to keep the standards of education as high as we need to be able to take care of an ever more complex number of people that have diseases because we're living longer, medications that are screwing up everything around our oral health, and that's a story for a different lecture, and a growing number of individuals with disabilities, whether developmental, intellectual, or age-related, accident-related. That's not a simpler dentist. That's a much more complicated individual. Let's look at some really scary stuff. In 2007, which is the last portion of the 21st century, in that 25 years, we went from 3 applicants per open dental school seat to 1.7, 1.8. This year was an aberration that it went up. Penn Dental Medicine, Pittsburgh, we don't suffer for applicants. We take 178 students. We have over 3,000 applicants apply for the school. The average acceptance is a 3.83 to get into the school. The average acceptance. It's incredible the people that are applying to dental school. But as that ratio drops and 4 more dental schools arrive on the scene, expect to see a commensurate decrease in that ratio. We're not getting as good a student. Let's take a look at a couple of things. When we look at applicants per million residents, Florida puts 4.1, New York 3.9, Pennsylvania puts 2.6 applicants per million residents in the state. Automatically, I worry about that. Look at the acceptance rates all over. That's the people that are competing to get into those seats, the same seats in my school that they are. You're looking at, we have 1.3 applicants per million getting accepted versus New York, which is 2.3. We're seeing less people from the Commonwealth apply. They are not as well prepared to get into those programs. And the implication of this is that they can't get into schools anywhere. This isn't just here in the Commonwealth that we're talking about. This is national numbers of people that come from the Commonwealth. Now, I do have to point out that the Commonwealth has one of the highest acceptance graduation rates from high school. We rank, I think, number 2. We rank 27th or 28th in graduation from 4-year colleges, though. A better question starts to come up about what the training is that those individuals have. So Penn is the private school of the 3 schools. I need you to understand some differences. Tuition and fees at both of the state stipended schools, and recognize that, you know, Ahmed has the good fortune, and I congratulate him on seeing $10 million on construction. When we did a program with Cedar, I had to invest $2 million private university dollars in opening up a Cedar clinic that delivers in an underserved community. Difference between a public and a private university. That's a giant difference in where we are. But recognize the acceptance rates. We're looking at about a 10% acceptance rates of the residents from the Commonwealth. The best that any of the schools are doing is a 19%. We're not seeing the applicants. You know, my eyes are bad. I can't see that far. I'm sorry, my New York sarcasm keeps popping out, and it's really uncontrollable. But they have guns in Pennsylvania, so I have to be careful. They can shoot me off the stage. But that's an important statistic for you to recognize. We're not seeing the applicants overall, and we're just not seeing giant numbers of people from Pennsylvania, and you'll see why that's important. So what's the number one choice reason for what schools students choose to go? It's cost. I like to think of it as value because we are much more expensive. You graduate from a Pennsylvania state stipended school for about $320,000 in tuition and fees, mine for about $450,000. But once you're up there in those numbers, by the way, does an extra $100K here or there really make a difference? You're already pretty in debt. You're doing more than buying a house out of it. We don't stipend our state universities enough, and to hear that out of a private university dean is a big statement. And we don't expect enough out of our state residents that attend them to put the service back into the state that helps stipend them. Academic reputation is really, really important in goings-on. When do students decide that they want to go become a dentist? I decided I was 16 years old. My dentist had 4 brand new Ford Mustangs parked outside his house. He was the richest person I knew. I said, I can do what he's doing. I'm going to be a dentist. I never bought a Ford Mustang. But wait a minute. We have to get to our students before they leave high school if we're going to see them entering the health programs. A student that chooses not to take physics, do STEM in high school, will never be able to get into dental school. They won't have the prerequisites. They will have a hard time getting into hygiene schools. We have to make sure that what we're investing inside is much more. All of these images came out of Copilot. I don't know what happened. I had a version that I had all of that inside there. I attribute all the images in there, but these images all came out of Copilot. It does start in high school. Its STEM education is absolutely critical, and they have to learn the value of doing that. And somehow we have to get to all of the health professions in the Commonwealth are suffering with lack of individuals applying and going to the Commonwealth, coming back to the Commonwealth. The number one factor on where you settle is actually where your family is. So if you're not getting people out of the center of Pennsylvania applying to dental school, you're not getting people in the center of Pennsylvania going back. It's not where you go to school, by the way. That data is pretty clear that it's where you come from, it's where your family. It can get messed up with who you marry, what the other relationships are that take place during the 6 to 8 years of going through it. But if we're not getting the applicants out of central Pennsylvania, to all schools, not just Penn, to all schools, we're not seeing them come back to central Pennsylvania. We have to encourage students to go to college. I know that's falling out of vogue today. College educations do serve a purpose. They are important, and we need to move that forward in every single way. Oh, I'm actually doing really well. You can take it easy on the cards. We'll be good. When students aren't interested in being dentists, the first person I blame is dentists. I always looked at, and I was a private practitioner initially. I was a private practitioner. I had a private practice until I physically came to Pennsylvania to be dean here at the school. Every young person I had in my office, I spoke to about careers. Whether it was hygiene, dental assisting, whether it was becoming a dentist, becoming a physician, but I spoke about careers because we are amongst the most educated in contact with them outside. We spend hours with our dental patient families. We have to think as a recruiter. Every young patient has to have the discussion. Let them come in and watch. Encourage them seeing the accomplishment, the joy that you actually get as being a dentist. My worst day was walking out of dental practice as a full-time practitioner. I enjoy what I'm doing, but I miss that interaction with families and changing all of those lives. If every dentist doesn't take that as part of their calling, that's a problem. Second, dentists, I'm sorry. We don't have a big enough workforce, and we're never going to catch up. We have to learn to have our primary care nurses, physicians, looking, doing, talking dentistry, and helping us in that process. Fluoride varnish is absolutely critical, and we should be having every primary care person applying it in anybody that has tooth decay, has even the signs or the risks thereof. We need to think about, in the Commonwealth, why is it that Westchester, no, not the Westchester in Pennsylvania, the Westchester in New York offers a scholarship to a Westchester resident who's going back to Westchester? We have to think differently to help bring people back to central Pennsylvania, to areas that need dentists. It's incredibly important. We have to think about tax structures that do different things. Loan repayment doesn't necessarily have to be physically loan repayment. It can be loan credits for people that are living and working in these zip codes that equal. We have to be creative. Making another dental school will just put a struggle to get good students, because I've already shown you that there's a problem getting enough students. It will have a struggle finding faculty, and even more, it will make a struggle to provide a bona fide education that you want to sit in that dentist chair. And that's what's really important. We need to think about, how do you get Amazon to come into your town? How are they getting Temple to come into Tamaqua? They're offering them buildings, loan repayments, all sorts of items around this. If we need dental practices in central Pennsylvania, we need to think about different ways of getting people to come to the parts of central Pennsylvania that you want to be in, that you need them in. It might not be State College. I don't know whether that's, I'm just picking my daughters at Penn State, so. We have to be specific, and we have to think strategically. Tax abatements, construction abatements, loan. It costs as much to make an office in central Pennsylvania as it does in center Philly. And the return on dollar, the population within a small space is much greater in central Philly. Now, if you give me 100 students and you show them, I don't remember which presenter talked about, oh, it was Marnie, talked about the hunting, the life, that's important. We have to get in and talk to our dental students right at the very beginning of their careers about what Pennsylvania offers other than the big city. Because the 3 schools are in the big city. And we have to get here, and we have to go to our surrounding states and look at what we're going to do to draw those individuals in. We do have to look for financial strengths and supporting our dental assisting and hygiene programs throughout the Commonwealth. Failure to do so leaves us perpetually chasing the resources. We compete to bring in the individuals that make our practices more efficient. In the end, I just need to say the Commonwealth has some of the brightest students available that are in my dental school today. We have to figure out how to get more of them applying to dentistry to want to be dentists if we're going to see them coming into the practices in the future. And that's actually where we need to place our effort. Thank you.
Thank you, Dean Wolff.